Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural living. I'm so happy to bring on board today as our guest, Dr. Joseph Pergolizzi, and he is a medical doctor and a leading pain physician who combines the latest medical advances and scientific breakthroughs with a profound professional compassion for patients facing painful, life-altering conditions. He went to St. John's University and also Ross University School of Medicine and Georgetown University and Johns Hopkins University of Medicine. So he has a long and varied history in terms of conventional medical training. And Dr. Pergolizzi is currently a senior partner at Naples Anesthesia and Pain Associates, and he works with Healthy Directions as an advisor and educator on natural solutions for pain management. As a physician, inventor, research scientist, and advocate for pain patients, Dr. Pergolizzi has authored over 350 peer-reviewed articles, abstracts, and chapters. And you can find him at drpergolizzi, drpergolizzi.com. And if you go to our archives after today's show, you'll be able to just click on that. Don't try to write it down in your car. So thank you so much for joining us today, Dr. Joe.
Thank you for having me, Ellen. And, I am a native Long Islander. I grew up in West Islip, so I'm very familiar with the community college there.
Yeah, so we're just a little bit west of that in Nassau County, and that's where we actually are airing all our shows out of, which is Nassau Community College. And thank you so much for being with us today. May I call you Dr. Joe?
Yes, please.
Now, tell us, going back in time, what made you decide to be a physician in the first place?
Well, that's a wonderful question. I get that a lot of times. I started off as a physical chemist, so that's more of like a rocket scientist. And it was a lot of fun, very experimental. And it allowed me to realize that beyond the theoretical physics, math, and chemistry, we want to be able to contribute to mankind. So I felt that becoming a physician might allow me to do that.
I'm interested too, because in your bio, and I don't know the answer to this, it says you are also an inventor. So what did you invent?
Sure. I hold probably about 50 patents around the world for medical devices, drugs, cosmetics, and genetics therapies. So there's a cadre of different things that I invent. And part of the reason I got into the inventing part of it is because in a clinic, I can only see so many patients at a time. And the type of patients that I normally would see are very sick. We call them tertiary care patients that would only attend to see a specialist like myself maybe once or twice in their lifetime. And so if I'm able to invent something that can help millions of people, it's very gratifying to me.
That's interesting, because when I decided to do radio and become an author, I've written many books, it was for the same reason. I was doing direct patient care, which I still do, but if you can't see 300 patients a week. Like I was up to about 100 and it was like, I cannot see 200. So therefore it's limited. And that was before the day of internet access, and it's easier to get information out there. So that's why I did decide to put a lot of information in books and offer radio shows, which are now called podcasts, even though this is actually an old-fashioned real radio show. For the same reason, that way your expertise could be spread to help so many people. As a pain specialist, I'd like to ask you something also, which is the whole opiate epidemic that happened. And I am a nurse. I'm a PhD RN. I work with a lot of patients in pain also. And I find it's such a shame and such a double-edged sword, because some of those medications really were able to help people in extreme long-term and chronic pain situations. But because of the mess that went on with the overprescribing and the addiction, now they've almost overreacted the other way to where no one can access that. And so they're in a lot more suffering at times.
One thing that we know is that pain is the most common reason why people seek medical care around the world. And chronic pain conditions are probably the second most common reason in the United States, beyond maybe diabetes or asthma, for adults to seek medical care on a chronic condition standpoint. Yet pain is not considered a disease in itself. It's usually considered a symptom. So it's very difficult to manage pain because the perception of pain is very personalized. I do not have a biological marker that I can use, like when I am checking for cholesterol. I can't test your blood or your hair or do a scan of you to say how much pain you have and how that pain is affecting you. So I think some of the principles related to pain medicine are still developing. Pain medicine itself as a discipline is still in an infantile age when we compare it, let's say, to the study of psychiatry, which has been around the United States, over 250 years. Pain medicine really came out of the desire to help cancer patients and the desire to try to manage pain outside of an institution. And in doing so, what we learned is that pain is very individualized. And maybe what happened during this period that you mentioned is that some of the focus went away from managing the pain and increasing functionality and activities of daily living, more towards just eradicating the pain. You started to see things like pain-free surgery, etc. So once you set those expectations in patients, then you set the paradigm. And this is one of the issues that may have happened. That, and also the fact that a lot of the doctors and nurses do not really have a lot of training in pain. Prior to about 2012, if we compared, which they did in a published study, the amount of time that a veterinarian is trained on pain medicine for the care of an animal versus a physician for the care of a pain patient, a veterinarian gets about 120 hours of didactic training related to pain medicine. And on average, prior to 2012, probably about 20 to 40 hours are what you received in medical school training. So if you think about it, every specialty except pathology, Ellen, has to deal with pain, right? If you're an ophthalmologist, patients come in with pain. If you're a gynecologist, a gastroenterologist, a dermatologist. So you don't necessarily have to be an anesthesia trained pain physician like myself. But instead, they're all dealing with pain, and they're dealing at different ages, children, older patients, adults. And so it's so specialized that I think the quest to try to address immediate gratification may have led to some of the potential overprescribing.
Yeah, that makes a lot of sense. It's not that the doctor was trying to do something necessarily incorrect. He just was enthusiastic to try to help people get out of pain, but then it's so addictive that in the long run, it may not be the best path. And I want to remind our listeners that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and today my guest is Dr. Joseph Pergolizzi, MD, and he is a pain specialist practicing in my home state of Florida, but on the other coast, which is Naples, and he is talking to us about pain. And since it's summer at the moment, Dr. Pergolizzi, how does hotter temperatures affect people experiencing pain?
Well, that is an outstanding question. And I could tell you that people who suffer from chronic pain seem to have more temperature sensitivity in the extreme conditions that we would see from the environment. So very cold or very hot. When we look at very hot, it's important to think about things that go beyond just the temperature, like the dew point. That's the humidity index. And when we combine high humidity with high temperatures, then we have the heat index. And the heat index actually makes you perceive the temperature maybe even 10 degrees higher than what it actually is. So high humidity and high temperature are not good things to experience. And with the record-breaking temperatures and heat waves across the United States and Europe, right? It can ignite or even intensify pain, especially for those who have chronic pain disorders like osteoarthritis, multiple sclerosis, fibromyalgia, chronic headaches, or migraines. And while the science supporting the link between temperature change and pain is not fully understood, it is commonly reported phenomena through the medical literature. And what we find is that people who experience these extreme changes in temperature are going to get exacerbation. And as I mentioned, there are some things like chronic migraines that may be more brought on or last longer or be even more severe. Osteoarthritis or rheumatoid arthritis, these patients will complain of more joint pain and muscle pain. Now, what might be going on there? You may be more dehydrated. Your circulation is not as good as it should be. These are some of the reasons why that might be happening. Multiple sclerosis, where we're thinking more of the nerves and the central nervous system, extreme temperatures and heat seem to have impact on these patients and worsen their symptoms. They can even result in visual loss in some patients. Fibromyalgia, these patients seem to be more lethargic, again, more pain, and this does seem to get worse as that heat index goes up.
Well, as you mentioned, Dr. Pergolizzi, you said there's not too much in the realm of laboratory diagnostics that particularly point to pain, but I know that many doctors measure things such as CRP and other inflammatory markers. Is that a way to kind of, associate, or one could be one way or the other without necessarily being diagnostic?
No, that's great, Ellen. I mean, if you think about pain, what's one of the first things that you're always asked? They always will ask you, how severe is it? Sometimes we'll use a scale, a numerical rating scale, 0 to 5 or 0 to 10, with 0 being no pain and 10 or 5 being the worst pain ever, depending on what scale you use. And this Likert scale is commonly used as an initial assessment to see how severe your pain is. And then we look at other ways of determining pain. We want to look at the characteristics and quality of that pain. Is there anything that makes it better or makes it worse? Are there things that you may be able to describe your pain, like electrical or burning or dull, aching type of pain? Are there additional symptoms that happen, like when I have my chronic migraine headache, I also can't look at the light. I get photophobia. All these different ways of describing pain are actually very helpful when a patient talks to a pain physician or any physician or healthcare provider that's trying to help you with your pain. If you tell them that it's affecting your activities of daily living or your functionality, these are very important. We have to remember that when you're in pain, then there is a psychosocial sort of deterioration of the human aspect of the person. And that shows in studies whereby people with chronic pain have a 38 or 40% higher chance of anxiety and depression. Not only that, everyone around you feels that pain one way or another because they're feeling bad for you, and they sometimes can't understand why this is happening. And it's very important that we use our verbal communicators when it comes to pain. Now, when we start to look at diagnostics, it's not uncommon that we use radiological findings, x-rays for a fracture, let's say. This could be common for a rib fracture. Somebody bumped up against something really hard and they continue to have pain in the side of their chest. It could be that. We also do look at some inflammatory markers. When is this even more common? When we look at things like rheumatoid arthritis, we actually do have markers there that we can use as directional. We look at patients who complain of chest pain, cardiac pain. A lot of chest pain is non-cardiac. So it's always important if someone's having a lot of chest pain, particularly dull, aching sensation of heaviness in the chest, to go and see a healthcare provider and make sure you're not having some type of related cardiac chest pain. But there's a lot of non-cardiac chest pain that happens as well. So though we don't have that actual marker, the best way for us to understand your pain is for you to describe it. And the more you describe it, the more impactful we are able to be with your management.
Well, I know that you've focused your whole life on helping people deal with pain. I know that some people it's harder than others because you can't always find a cause. But what are some of the things that could be helpful in terms of like lifestyle and how would healthy directions, because you must be motivated to work with healthy directions. Why are you working with something called healthy directions as a way to support people with pain?
Sure. Well, part of it is that, this company holds to the highest standards when it comes to providing non-pharmacological grade products, but they also have topical products that have compounds like menthol in it.
Let's talk about topical a little because topical, I think, is so phenomenal. I think it's underused because you're also not getting an issue so much, let's say, like you might with herbs and drugs. There's not so much of an interaction phenomena with topical, yet topical can also act as transdermal. And the difference, of course, is topically when you put something on and it stays in that area for a local effect. But many of these things can pass through the skin, like we know in medicine with estrogen packs and smoking packs. So they really can have a vast effect that is very positive when they become transdermal. What are some of the things that you would recommend people look for in a topical applicant?
Excellent question. And I would go a little further. When we did a survey at Pain Week, which is the number one attended pain conference in the United States, we surveyed pain practitioners, which included doctors and nurses and psychologists, and they recommended as first-line therapy when you're thinking of some type of medicinal opportunity to use topical products. Why? Because if you have muscle or joint pain that's close to the skin, these can be absorbed very quickly into that area. Now, you did an excellent distinction between topical, which is supposed to stay in the area, and transdermal, where we use the skin, the largest organ in the body, to bring drug into the systemic circulation. And what we do there is we try to control the amount that gets in through the skin into your blood and circulates around the rest of your body. And in doing so, we're able to avoid taking it by mouth. And if you can avoid that, you avoid getting it broken down in your liver, what we call metabolized. And some drugs, when you take them through the mouth, they get broken down a lot, and they may not be as effective as we'd like them to be. So transdermal is different than topical, as you very correctly pointed out. And when we look at topical, some reasons we like topical is because it's right where the pain is for a pain reliever or a pain rub. So it's usually in the joint or the muscle area. And you can apply it usually quicker, a second or third dose, than you can take an oral medication. So you can keep putting it on. Now, that doesn't mean you can bathe in these things, but it does mean that you could probably address your pain a little bit more from a management standpoint, because you can reapply it quicker than you would taking the oral over-the-counter pain medicines. And there are some products that mix natural oils with known pain relievers. So I have a product that I created when you mentioned invented, a combination of a natural oil with menthol. And a very low dose of menthol in combination with this natural oil produces very nice responses for muscle and joint pain. So topicals are very helpful. Transdermals are helpful when you want to avoid metabolism. And we have lots of different types of ways of doing that.
So that's interesting with menthol, because many companies that I've worked with have purposely included menthol in their topicals or their transdermals, specifically because you can then get registered as an over-the-counter. It takes it outside of the realm of just like a dietary supplement or just a natural kind of thing. And it's really so helpful. So that's really great to include menthol in the product. What other things might someone look for?
Sure. When you look at topical rubs, you want to make sure that you're looking at some of the excipients, meaning the non-active ingredients that are in these products, because some people can have allergies to them. So you want to make sure that if you have a sulfur allergy, that you're looking closely. And you also want to make sure that if there's an alcohol element to it, some of the rubs may be more liquid-based and will have alcohol. That can cause irritation on the skin, etc. Another thing I can mention about topicals and transdermals, that a lot of times we use ice and heat. I'm a big proponent. If you look at heat, it's actually called dithermy. And there are devices, one I'm developing, that help try to use heat to relieve pain. And when you look at ice and heat, you have to realize there's a reason why we do that. When we give ice, what we're trying to do is we're trying to stop, reduce the amount of blood flow to that area, release natural types of pain relievers from your body. Same thing with heat, and why we alternate it. Heat, you increase the blood flow to the area. You remove the oxygen-free radicals. You remove the buildup of all what we call the peripheral sensitizing soup, all the stuff that causes the pain. You flush that out with increased blood flow because it's warm in that area. But when you put topicals on or you use transdermal patches, you want to really watch what you do when you put the heat on that area after you've applied them, because your skin opens up. The pores of your skin open up, and they can actually make more of the medicine, if it's transdermal, go into your system. Or if it's topical and it's not supposed to go into your system, now it does enter the system. That's why if you ever get a patch, they'll tell you don't put heat directly on top of the patch.
That's a great explanation. People might have seen that with a nicotine patch or a hormone patch.
Scopolamine patch for travel sickness.
So they specifically say, if you're going to use this patch, don't put like a heating pad over.
Right, or go in the jacuzzi or a sauna, because your pores open up, and when your pore opens up, it dumps more of the medication in. And
so
then you
more
get
than
more
it was
directed, right.
So it was planned to not have that, and then if you have it, you might get too much of it. That's interesting. What kind of oil is combined with menthol? Because you said it's a very specific oil applicant.
Well, it's very tough, and that was part of the invention, is that, menthol too is an oil, so combining two oils is tough. And then having it be stable, and meaning that, when you use it, it doesn't leak all over the place. Getting a proper smell to it. Right? You don't want to smell like a medicine chest. I could show you some studies out of Harvard that showed when we put typical pain-relieving creams under the nose of a patient in a functional MRI, that parts of their brain lit up as if they were in pain, because you're identifying with that smell. So it's quite a challenge, and that's where my physical chemistry comes in, my background, to be able to mix different types of like corn-based oils that have a lot of oxygen pumped into that oil with menthol, and then making the formulation stable. That's what we were able to do with Instaflex.
Oh, that sounds like a good choice. And, right now, of course, there's a lot coming into the market, which we probably won't have time to go into deeply, but in the cannabis space, with that being added into many oils that claim to have pain relieving effect. And many of my clients say that it has helped them, with muscle relaxation and that kind of thing. So there's a lot of room for more experiments and more inventions. So we're really lucky to have you on the case. Now, where might people find out more information?
Sure, they can try healthydirections.com or my website, which is www.doctor, and that would be Dr. Pergolizzi. So DrPergolizzi, drpergolizzi.com.
And are you still actively working within the house? You said you actually are in Naples.
Yeah, I do. I'm a tertiary care pain specialist, so it's a little different. Maybe the average doctor will see 40 patients a day, maybe more, much like what you were seeing, Ellen, in your practice. The type of patients I see are very sick, unfortunately. They have lots of comorbidities. And so I don't see as many people because I have to spend a lot of time with them. And in doing so, quite honestly, a lot of it has to do with just touching and moving the patient around and talking with them. It takes a lot of time to understand why this patient's still in pain after their healthcare providers have been caring for them and loving them and do everything they can.
Can't find a reason. You often can't find a reason because there could be a nerve pinch somewhere, or there could be a message that's been memorized that's incorrect within the nervous system. So
that's called chronification, and you're absolutely right. And we don't know if there's a way back, Ellen. Right? That's why we want to address acute pain aggressively and adequately with appropriate measures. And appropriate measures are both pharmacological and non-pharmacological. And when we combine them, this is called integrative medicine. And when we go a step further, it's called multimodal pain therapy. So that's what we try to do. That's why if you think about some of the things that you can do that are beyond taking a medication or getting an injection, healthy benefits are seen from positive thinking, right? That positive thinking increases lifespan, it lowers rates of depression, lowers rates of stress, it actually decreases pain. And keeping positive when dealing with pain, you want to try to manage your stress, those negative feelings. You want to stay active, think positively, try visualization. A lot of virtual reality tools are now being made because of this.
That's
sleep.
Interesting.
Yeah, I can't tell you enough about sleep. I mean, I don't get enough of it. I never got more than 4 hours a day, but sleeping is very important. You want to keep a journal. And you want to get support, and you want to have your family involved. There are a couple other things I can mention too. I love massage therapy for my patients, whether it's a Swedish hot stone or aromatherapy or deep tissue or reflexology or any type of couples massages is always helpful for my pain patients. One last quick one, grounding. My recently deceased friend, Steve Sinatra. Really,
wait a minute. Wait, I have to stop you there.
Yeah.
What do you mean deceased?
Yes, unfortunately, Steve passed away.
Sorry, listeners, this is a private moment between me.
Yeah.
I just was speaking to him recently.
I know.
Suddenly.
It did.
Goodness.
It was a major loss. It came out of nowhere. Steve has been pushing me for years. He's been working with me for years.
We just did a show on grounding. Oh my God! But I know him 40 years at least.
Yep.
Well,
So Steve,
sorry to hear that, but thank you for sharing.
Certainly. And, many times I talk to Steve about just taking your shoes off and socks off and digging them into the ground or in the beach or in the, just reconnecting with Mother Nature is very important too.
Well, thank you so much. We're going to have to stop there because we went over time because that was shocking news to me. Oh, boy.
Sorry.
We'll talk about that further, but thank you so much for being our guest. Fascinating show and great information. We've been speaking to our guest, Joseph Pergolizzi, medical doctor. And thank you for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.